Patients Beyond Borders, an organization that helps find medical care in other countries, says up to 1 million U.S. citizens travel each year for medical procedures in other countries. For Americans, Mexico is the most popular destination. Patients can save up to 70% on procedures. Joining me now from Baltimore, Natasha Murphy, the Director of Public Health at Center for American Progress. Glad to have you on the show. Really, Natasha, what this points to is a fundamental problem with the American healthcare system when people are forced to travel to other countries to get medical procedures.
Yes, and thank you so much for having me, Roland. Truly a pleasure to join you and your viewers tonight. As you mentioned, you have Americans who are traveling in droves to foreign nations to seek healthcare services. And the primary driver behind that is the cost of services here in the U.S. So you have individuals who are uninsured, underinsured, or even those with insurance who know that to seek more affordable care, they have to leave our nation's borders and visit countries like Mexico and Costa Rica to get the healthcare services that they need.
And as I say, I mean, we're talking about just all types of procedures, and we're not talking about a place like Canada. I mean, again, I know somebody who went to Turkey for veneers.
Yes. And it, like you said, Roland, it is a mix of elective procedures, necessary procedures, as well as some of the cosmetic work. People are willing to travel the hundreds of thousands of miles to seek care that is more affordable because they know that they can't afford it here in the U.S.
And so when we talk about, what are some of the other countries we're talking about beyond Mexico?
Sure. So one of the most popular destinations, in addition to Mexico, are places like Costa Rica. You also have areas like Thailand and India. And these are some countries that, due to just the dynamics of their healthcare landscape, you know, their governments play a more active role in negotiating prices and negotiating for more affordable elements like prescription drugs. And as a result, their healthcare costs are significantly lower. And that really is enticing Americans to cross borders to seek care.
So from a congressional standpoint, state standpoint, is anyone trying to do anything about this? Because obviously we've heard these folks were two lost their lives. Other people have actually died getting various procedures in other countries because you don't have the same standards that you do here in the United States.
Absolutely. Oftentimes, the cost of medical tourism can be your life, which is much higher a price than necessary. And so our lawmakers at the federal and state level do recognize that affordability is a primary concern for their residents and for their voters. And so potentially impactful reforms that have been explored at the federal and state level include policies and bills that would limit surprise medical billing and prevent some of the severe medical debt that we've seen in this country. In addition, there's been a huge push to advance transparency requirements that would inform residents and consumers up front about the costs of their healthcare services before they seek them. And that's been incredibly impactful in just providing people with the information that they need to know ahead of time. And then finally, it is critical that we expand access to affordable and comprehensive health coverage. Individuals should have access to insurance that they can afford and that covers the litany of health services that they need.
All right. Natasha Murphy with Center for American Progress. We appreciate it. Thanks a lot.
Thank you.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. When you talk about blackness and what happens in black culture, we're about covering these things that matter to us, speaking to our issues and concerns.
This is a genuine people-powered movement.
There's a lot of stuff that we're not getting. You get it, and you spread the word.
We wish to plead our own cause. Too long have others spoken for us. We cannot tell our own story if we can't pay for it. This is about covering us. Invest in black-owned media. Your dollars matter. We don't have to keep asking them to cover our stuff. So please support us in what we do, folks. We want to hit 2,000 people, $50 this month, raise $100,000. We're behind 100,000, so we want to hit that. Y'all money makes this possible. Checks and money orders go to P.O. Box 57196, Washington, D.C. 20037-0196. The Cash App is $RM Unfiltered. PayPal is R Martin Unfiltered. Venmo is RM Unfiltered. Zelle is Roland@RolandSMartin.com.